just deep to the epidermis is the dermis of our skin. The dermis is made of connective tissue, two different types of connective tissues actually, and this is what gives our skin its strength. Your skin doesn't tear, it's really resistant to pulling and stretching forces. We call that tensile strength. And that tensile strength, that resistance to tearing and pulling, comes from the protein fibers that we find in this connective tissue of the dermis. Dermis is very, very strong stuff. It's actually what the hide of an animal is. When we talk about an animal skin products, leather products, they're so strong. There's a reason why leather jackets are protective for individuals that, like motorcycle riders, for example. It's because that connective tissue is so, so strong. Tons and tons of collagen fibers make that very resistant to tearing. So it makes it nice and thick, nice and strong. Next time you see somebody wearing their leather jacket, you can be like, hey, nice dermal jacket you've got there, because that's exactly what it is, a ton of collagen from the dermis of the animal. Dermis is very vascular, and it's also innervated. So those are two properties of the connective tissue that we're going to see in the dermis. Remember that the epidermis is avascular. So that epidermis, those keratinocytes, melanocytes, Merkel cells, they all rely on the vascularity, the blood circulation of the dermis for the nutrients and materials and the elimination of waste that those cells rely upon. The dermis assists with thermoregulation. So I mentioned this when we started the lecture, but here the thermoregulation of the dermis is primarily from the dilation and constriction of those blood vessels. When your body gets too hot and starts to overheat, one of your cooling mechanisms to bring body temperature back down is to send more blood to your surface of your body, more blood through the dermis. When those blood vessels of the dermis dilate, more blood circulates through the body's surface, and that allows more heat of your body to be lost to the relatively cooler environmental temperatures around us. This works when the environment around us is less than body temperature. But of course, if you're in a hot environment, this is not going to be quite as effective as when the outside temperatures are below 98 degrees. We also find that the opposite happens during times that we're cold. So body temperature starts to drop, those same dermal blood vessels can constrict and reduce blood flow through them. When that happens, less blood is sent to the surface of the body, so we result in less heat loss to the environment. Okay, so our two layers of the dermis are the papillary layer and the reticular layer. The papillary layer of the dermis is the superficial, about 20% or so of the dermis. It's named because of these dermal papilla. The papillae actually is the name when you say them plural. One of them is a papilla. So these papillae, they form this kind of intercalation with the epidermal ridges that you're seeing here, and that results in friction ridges on the surface of your stratum corneum. The friction ridges are your fingerprints. So it's the dermal papillae that connect to the epidermis. Again, the difference between a flat line and a wavy line is surface area. More surface area here results in a tighter connection. You can also imagine, like if you were to put your fingers together flat, how easy it is for your fingers to slide across one another. But if you were to put your two fingers together and interdigitate the fingers, almost like you're folding your hands, your fingers kind of over one another, and you tried to shift your fingers, they form a stronger connection in that way. So that's exactly the same property or principle that's applying here. If your epidermis were to be rubbed on the surface, and that were to just slide the epidermis and separate it from the underlying dermis, then we would end up with a big pocket here, a big bubble that would fill with fluid. Those big fluid-filled bubbles are blisters. So blisters occur when the epidermis separates from the underlying dermis. It's pretty rare for a blister to occur on our skin because of the dermal papillae, because of this nice tight connection between epidermis and dermis. It really takes a lot of friction, a lot of rubbing for that to happen. The Friction ridges on the surface, the fingerprints, they're great for more than just identification. We actually use our fingerprints for grabbing things. You wouldn't be able to hold a smooth object, a slippery object, if you didn't have these friction ridges. You'd find it very difficult to turn the page in a textbook. These smooth structures would be difficult to grip. So your friction ridges actually give you gripping power with just the tips of your fingers and your toes for that matter as well. So those are the functions of that, those dermal papillae. This superficial 20% of the dermis, so again, the papillary layer of the dermis, is mostly made of loose areolar connective tissue. So if an arrow was pointing to this area of the dermis here, and I asked to name this layer, the name of the layer is the papillary dermis. If I were to ask name this tissue type, the name of the tissue type is areolar connective tissue. Fibrous connective tissue proper, all 3 protein fibers, and a good amount of ground substance within the areolar connective tissue. Up next is the deeper 80%, and that's what we call the reticular dermis. Now, the reticular layer of the dermis is made of dense, irregular connective tissue. So a dense packing of thick collagen fibers. These fibers are all running every which way, which is what makes it irregular. They're not parallel to one another. You've got collagen fibers running this way, running that way. Again, some coming straight out at us, up and down, across. Collagen fibers are running every which way in a dense, irregular connective tissue. It is the reticular layer of the dermis down here that gives the dermis its resistance to pulling forces, gives it its strength. All of those thick bundles of collagen are going to give the dermis its strength. Interspersed amongst the thick collagen bundles are also some elastic fibers. Your dermis is quite remarkable. It's resistant to pulling forces and stretching forces, but it also can stretch just a little bit. And that elasticity property is an important one for us to be able to stretch our skin as we, for example, might bend a joint. Bending at the knees stretches the skin on the anterior surface of your leg. So those kinds of movements are going to create some stresses, and the skin does have a little bit of extensibility. The ability to stretch and recoil comes from those elastic fibers. So that's your dense irregular connective tissue known as the reticular layer of the dermis. You'll also find on our models and in the histology preparations that the reticular layer of the dermis is where all of the dermal appendages, or epidermal appendages, I should say, are going to be found. These epidermal appendages are all going to reach the epidermis, but they're located mainly anchored down in the reticular layer of the dermis, sometimes even deeper and into the hypodermis. So structures like your hair, your sweat glands, those are sebaceous glands, they're all going to be found down in the reticular layer of the dermis. Alrighty, so that bottom or deeper 80% of the dermis, the reticular layer, is known for having tons and tons of collagen running every which way, which is what makes the dermis so strong and so resistant to pulling forces in all directions. There are parts of our bodies, however, where our skin is repeatedly under stress in a consistent direction. And we find that this leads to the growth and development over collagen over time to resist the repeated pulling forces in the skin. As I mentioned, when you bend your knees, for example, we're going to see that the skin is being stretched in this direction in the thigh. It's being stretched in this direction in the lower leg, in the crural region and in the femoral region. And so these lines of cleavage that you're seeing on this illustration are representing what we call kind of like the grain of collagen. Yes, the collagen in the skin here does run every which way, but there is a predominant bundles of collagen, many, many bundles of collagen that happen to run in this direction. So if I were to perform surgery on somebody's thigh and I cut across the lines of cleavage, if I cut across the collagen bundles, that would also cut across the elastic bundles, and it would cause the skin to pucker out. So that elasticity would be gone. Usually this results in a slower healing time and potentially even the formation of a fibrous scar. If, on the other hand, a slice or incision is made that cuts with the grain or with the line of cleavage, then there's a reduced number of collagen fibers that get cut, a reduced number of elastic fibers that get cut. Healing time is sped up, and the individual is much less likely to scar in that case there. Stretch marks. So stretch marks are actually usually the result of rapid stretches in the skin, usually caused by rapid weight gain. This can be potentially also caused during pregnancy when the skin is stretched pretty rapidly. In this time, collagen gets torn, and if the collagen is torn, that means that the elastic fibers failed with their stretch and recoil. And this torn collagen, these little microscopic tears in collagen, is what results in the stretch mark. It's essentially like a little mini scar in the skin resulting from some of those collagen fibers tearing. So that is the dermis. Next up is the hypodermis. Remember that the hypodermis is not officially a part of skin. This is the layer that's located just deep to our skin, just deep to the dermis and the epidermis. The major tissue type that we find in the hypodermis is adipose connective tissue. That's what we're seeing here. All these little white bubbles, those are the adipocytes. So adipose connective tissue is mostly what we find in the hypodermis layer. The hypodermis acts as an excellent insulator, so reduces heat loss, which is why we need those blood vessels in the dermis to be able to constrict and dilate to allow more heat to the surface or less. Another thing the hypodermis does is obviously stores lipids. So it's a great place to store excess energy in the body. We can tap into it for that energy supply. And again, the hypodermis allows the skin to glide on the surface of deeper organs. So we get this ability to kind of rub your skin without really causing friction or too much damage to the deeper muscles and the bones that might be located just deep to that skin. Hypodermis provides a little cushioning and it allows the skin to just kind of glide on the surface of those deeper organs. The hypodermis is a popular location for the injection of medications. You've heard of hypodermic needles. That is a needle meant to penetrate through the skin and get into the hypodermis. The injection of a medication into this connective tissue in the hypodermis is usually going to result in a rapid uptake of that medication into the bloodstream. The reason is the hypodermis is very, very vascular. Typically find lots of arteries and veins in the hypodermis layer, this adipose connective tissue layer.